Good morning, everybody. Happy New Year, and welcome to our weekly live question and answer series, where we sit down with Dr. Ellithorpe and look to questions from you in the audience to ask the doctor on how we would approach this if she was sitting with a patient in her office. And of course, this is meant for education and information for us all to learn, but this is not meant to replace your relationship with your doctor. Do not take any of this as personal medical advice. Be sure to follow up with your healthcare provider on your questions specifically, of course. Thanks for joining us today again, Dr. Ellithorpe.
Always a pleasure. I certainly enjoy doing this.
Yes, me too. I'm looking forward to a great year, hopefully.
Yes, we will.
Amen. Well, you can interact with us a couple different ways, and that's what this is all about. You can post your questions in the chat section off on the side of YouTube here. That's the best way for us to answer your questions here in real time. You will need to be logged into YouTube to be able to do that. And the other way that you can send your questions in is to our email address, office@tlcdoctors.com. And just make sure that you put something in the subject line, questions for YouTube, live Q&A, so we can make sure that that gets sent to us. And we're getting a lot of those questions sent in, a lot of emails, more and more, and it looks like this series that we're doing has become very popular, so we're going to do our best to get to all your questions. We're going to prioritize the questions in the chat, most likely, and if you do send your email questions in to us, we'll be sure to include those, but we're getting a lot of them right now. And just want to make sure that you are following up with those questions with your doctor, because that's not always timely for us to get to those questions. All right, well, I can see that we are already getting questions in the chat. Should we jump in and get started?
I had one thing on Monday night when I do my Monday at 6 o'clock in the evening till 7 o'clock. Carol Wheel had asked a question about black seed cumin. And she was using the common name, but the generic name is Nigella stevia. And this is a herb from the black seed cumin that is being associated with benefit recently involving the SARS-CoV-2. And I was not familiar with the black seed cumin reference, but I was with the Nigella, N-I-G-E-L-L-A, stevia, S-T-I-V-A, okay? So, yes, Carol, it is something that seems to have benefit. Dosing and so forth is not sure. I'm not sure of dosing. I haven't needed it, Carol, because we've done so well. With what we do, the standard things, the lifestyle changes that we've been saying for decades here: watch your carbs, drink your water, get a good night's sleep, don't go to bed late, don't sleep in late, lower your carbs, take your vitamin D, and then other certain micronutrients that we had as antioxidants and Juice Plus, vitamin C, systemic enzymes. So do we need these extra little things, Carol? I probably would say no. I would say that there's a lot more research on quercetin, for which I've used liberally, and everyone has done well. It's as if there was no pandemic that came by us.
Okay.
So see, I do check. I do check.
First question to us in the chat is from Deborah, and she says, need advice. My daughter became ill over the weekend with sore throat, runny nose, some blood when blowing her nose, tired, chills, headache, not going into work today. No fever yet. What would you recommend? She does take TLC Energy Core, but it's almost gone. She has Virusid. How many do you suggest she take of Virusid? Also, how many Dehist? Quercetin, thank you.
I would use 2 Dehist, which has 200 milligram per capsule, 2 twice a day. I would use the Virusid. I don't recall the exact amount on the bottle. I would follow the bottle instructions. I think it's 3.
Right.
And that has the zinc in there and various herbs that are very valuable in antiviral illnesses. I would make sure she's on vitamin D. I would give her 5,000 international units of vitamin D3 every day. I would keep her on a broth type chicken soup diet so that her immune system is working on healing her rather than working on digesting food. I'd make sure she drank half her weight in ounces every day. And I would consider an immune drip. We have walk-ins for, you could do a vitamin C drip here if you wished. But between D-Hist with a quercetin in it, TLC Energy Core that has the B vitamins and various multi-minerals and extra zinc, the vitamin...
Virusid, vitamin D.
Yeah, vitamin D. And, you know, if you have some extra vitamin C, I would use that. And just observe and see how she's doing. I think she'll do fine.
And if this, you mentioned 5,000 IUs of vitamin D, if this is an adult or adolescent, they could take more vitamin D for a short period of time, correct?
Mm-hmm.
Okay.
So I would say in the course of, I don't know if her daughter's, you know, 4 years old or 14 years old or 24, I think 5,000 a day for 7 to 10 days is very good.
Okay. Next question comes to us from Robert, and he says, my entire family got the stomach flu. We all felt horrible for a few days, but then better. In general, how would you treat the stomach flu? Everyone is still very tired and sore.
Well, the stomach flu creates damage to the epithelial of the gut. That means you're at higher risk for leaky gut. So if you would work on a diet that rests the stomach so it can heal, a 24-hour to 48-hour, or even a day and a half, 36 hours of just a clear liquid diet. That's generally what we do for the stomach flu, is just rest the gut. See, written in the DNA of our body is how to heal everything. So we need to get out of the way and let the body heal itself. So if you were a day to 2 days on just chicken broth, beef broth, and you can mix some ginger ale, that's real ginger ale, because ginger is an herb that is calming to the gut. If you mix that with water, half and half, then you're going to get your energy from the glucose in ginger ale. You're going to get adequate hydration with the water. You're going to get the salts and electrolytes and minerals from the chicken broth or the beef broth. So have everyone just swear off food for a day and a half and just be on the broths, and I think you should do very well.
Question from Amela that says, my cousin... Oh, I skipped one here. I'll come to that next. Jennifer says, hi, doctor. A friend has COVID. For early treatment, the FLCCC recommends 2 times the quercetin and zinc that's in Immune Protect. Safe for someone with COVID to double up on Immune Protect dosage. How many days?
I would say it's fine to double up on the Immune Protect for, 7 to 10 days. Mm-hmm. It would be quite fine. Or you could get some D-Hist. That's a reputable company, Orthomolecular, and they have 200 milligrams in each capsule. Now, I'm not taking Immune Protect because I'm on TLC Energy Core, I'm on TLC Multi-Minerals, and I'm on quercetin, 4 capsules a day. That's 800 milligrams, and that's what I'm on all the time. That's something I take every day of my life, and I've never gotten ill from anything around here or anything that people have been bringing me. So I think she'll do fine, doubling that up for about 7 to 10 days.
Okay. Amela says, my cousin's son is 15, blood type O positive. He gets black vision sometimes for 1 to 2 seconds upon sudden getting up. Could that be a sign of anemia?
Yes, and it could be a sign of lack of hydration. So if he feels like it goes dark when he's getting up from bed, he's probably eating the standard American diet and not drinking water. Instead, he's drinking energy drinks and lattes and things other than water. I think if you would have him drink half his weight in water every day for 1 week, that'll all go away. All of it. And then you got to start talking to him about lifestyle. Why has TLC and our thousands of patients done so well? And we care for people who are working with their oncologists, with their cancer, with their cardiologists for their heart failure or heart attack history or their hypertension, or we have diabetics, we have the obese, we have the autoimmune disease patients. Why did all of us do well? Because we talk about lifestyle here. And the children, we've seen a doubling of the epidemic of obesity and diabetes in the young children, especially from these unfortunate measures they chose as public health initiatives to lock everyone down based on no science. And so these kids are there with YouTubes and eating, YouTubes and eating, YouTubes and eating, and their games and eating. And they are eating hydrogenated fats, trans fatty acids, high carb, sugar, immune depressing material, drinking not water, but all these foolish drinks, and they are becoming ill. And so now we will see that there's the high correlation between obesity and anxiety with, disease risk for viral illnesses. So you have to have this young man watch the YouTubes on Sugar the Bitter Truth. Have them watch that, or some things about sugar and immunosuppression, and get him drinking water and see how that is, and have him see his doctor and check his blood count and go from there.
Okay, Cami asks, what can you do for rheumatoid arthritis?
Lots. We have many people with a history of rheumatoid arthritis, this autoimmune disease, juvenile rheumatoid arthritis, all the arthritides, and this is a lifestyle-induced disease because of leaky gut. So you eat a standard American corrupting diet, it injures the lining of your gut then leaks in foods that you're eating, that triggers your immune system, and about 70% of your immune system lines your immune system, your gastrointestinal system. That then creates antibodies to these foods that you're commonly marketed to eat over and over again. Many of these have an unfortunate cross reference to your own joint cartilage and bone areas, and then you start getting inflammation there. We don't drink enough water, so we always tell people to drink water. So we begin with the gut. We tell them eat a one menu day, eat a protein and one vegetable cooked. And we say cooked because that decreases the lectin and the difficulty of digestion. So we tell you I have usually a beef and broccoli day, then a chicken and green bean day, then a pork chop and spinach day, then a salmon and asparagus day, then an egg and Brussels sprouts. That's typically the realm that I eat in. And what this does is it narrows down the messages that you're presenting to your gut lining. That promotes a reduction in the probability of triggering your immune system and inflammation. Then we tell you to eat only between noon and 6 p.m. so you have 18 hours a day where your gut can heal itself, and it will heal itself, especially if you're providing the healthy fats and proteins that make up the bilipid membrane there. Then we ask you to take systemic enzymes like Vitalzyme. In particular, if you're having problem, we use the highest quality Vitalzyme, and I would have you take 5 twice or 3 times a day on an empty stomach. So first thing in the morning when you wake up, maybe an hour before lunch, and then at 9 o'clock at night when you go to bed, drink half your weight in water. Maybe use Tariva, which is the orthomolecular whole root curcumin, turmeric, which is an anti-inflammatory. And that would be the beginning of how we would treat this. We would do lab tests to look at food sensitivities and follow you along. Hormones help repair the joints as well, and so forth.
Okay. Donna says, if a member of my family tests positive for COVID, should I give them ivermectin immediately, or is there something else I should give them?
Well, the protocol is suggesting that early treatment, so if you've turned positive, it would suggest that you would use it for 5 days. And so I would go ahead and use it.
And then all of the other things that we say over again and again, the zinc, the quercetin, TLC, the Immune Protect is a great formula.
The vitamin D.
Right, and the vitamin D, of course. Next question is from David, and he says, what's the best way to communicate privately with Talon regarding an administrative issue? David, you can, I see your name here, and I believe I'll give you a call. You can also email me, talon@tlcdoctors.com. That's my first name, Talon. But I'll be giving you a call, and I did see an email that was forwarded to me yesterday, just to let you know we're really, really busy right now. We're facing some short staff issues, and this is the busiest time of the year with us, so I will get in contact with you today. Okay, Donna Lynn says, how does TLC treat possible prostate issues of ED? I'm assuming that's erectile dysfunction. Yes, infrequent urination. 60-year-old male, in shape, does a lot of supplementation, does not want to do drugs.
Well, EDTA chelation improves microcirculation of all the blood flow throughout the body, including erections. And so that would be a foundational part. Systemic enzymes would be a very important component, taking 5 twice a day, being on a time-restricted eating, noon to 6, or a 1 meal a day, being on certain things that help depress the impact of estrogen. Estrogen can grow in a man if he drinks alcohol. So we tell men with prostate issues, erection issues, to not drink alcohol, because that will promote in a man the excess buildup of his estrogen, because men make a little estrogen, which makes the gland, the prostate is very similar to breast tissue, and so that'll make it swell. And that will create compression and difficulty. So alcohol and a high-carb diet both promote elevations in estrogen in a man. So a low-carb diet, eating in a time-restricted or 1 meal a day, chelation, enzymes, and we would give them diindole methane to block estrogen, or we could give them anastrozole, that's a prescription, 1/2 of a tablet, 0.5 milligram twice a week. With the EDTA chelation therapy, and then looking at certain things about them, we should see great improvement as well. So we saw great improvement with chelation in our men's study.
We did.
So that's how we would do it.
Have you seen much success with supplementation using L-arginine or nitrous oxide?
I'm going to say I've been disappointed in the products. I've been much more impressed with fasting, time-restricted eatings, EDTA chelation therapy, because none of the men in our study in 2006 were on L-arginine products. They just used chelation therapy.
Right.
I'm not against L-arginine supports, but by the way, EDTA chelation promotes vasodilation and nitric oxide production. So every time you chelate, you're getting an extra boost of circulation. Also, on the multidimensional impact of EDTA chelation is helping to promote nitrous oxide synthetase, which is an enzyme in the very lining surface of your blood vessels to help produce more nitric oxide. And then, of course, we can give testosterone as well and monitor that. So we're usually very happy with our results here.
David says, I'm on day 3 of my 5-day fast, feeling great. Thanks for your inspiration.
Yeah, I just finished my 5-day fast last night. So I'm feeling very good today after my roast beef that I ate.
Cheryl says, what can I do to find out food allergies?
You have to get a test for that. There are IgG, which are the slow immunoglobulins that are produced from chronic reactions. Then there's the immediate IgE, which are the immediate hive-producing, itching, anaphylactic swelling, throat swollen shut, life-threatening. So you probably don't have IgE problems because you would have learned that by now in your life. So we do the IgG, and this typically is not done by your standard doctor because it takes time for you and your doctor to explain why you need this, how we're going to do a rotation elimination diet, intermittent fasting, and work to address those IgG slow reactings that we believe are slow killers. If IgE could immediately kill you with anaphylaxis, IgG will slowly kill you from your lifestyle and diet, leading to colon cancer, colitis, Crohn's disease, rheumatidities, neurodegenerative diseases, because that same pathway, you can attack the nerves. So, yeah.
Okay, so you're going to want to find a doctor that is a functional medicine physician integrative clinic, and they should be familiar with the IgG food sensitivity test. We use two companies for that. The one that we've used the longest and Dr. E is the most comfortable with is called ImmunoFoods, and they're based out of Florida. It's a blood test, and they send results back to us in about 3 or 4 weeks, and that shows you what food and at what level you're sensitive to. They test, I believe, like 156 different foods, and that test has helped a lot of our patients learn what foods to avoid. Now, if I know just from when I eat foods that, for instance, if I take a bite of a fresh pineapple, my mouth, I feel, has little cuts or sores in it, or sometimes tomatoes do that to me. Is that IgE, just a lower grade IgE, or is that something else in the pineapple that my body doesn't like?
You're not supposed to ask me questions that I don't know, Talon.
Sometimes I don't get hives or have difficulty breathing, but there's certain foods when I eat them immediately I don't feel that good, and so I just avoid them.
Yeah, there is also your parotid glands are squeezing down. Sometimes people, as they age, they don't have as good lubrication and functioning, and they'll start to eat something, and then that will create some of this tingling pain or response. So I don't know if it's your parotid glands or because you're unique.
Okay. Well, while we're on the subject of food sensitivity, I received an email last week from Donna, and she said, I just received my IgG food sensitivity test results. 11 items showed up: cheese, cranberry, kale, malt, tomato, pepper, wheat, bakers, brewers use papaya, and mushroom mix. I don't eat papaya, but it's in Vascuzyme and the digestive enzymes. I also take Dehist. Do I stop taking these supplements during my 90-day period, or do the benefits outweigh the antigen results?
The benefits outweigh the antigen results, because over the many, many decades, I've always used this, and the amount that's in a supplement compared to the whole food product and the weight of that product is astronomically bigger. Plus, these are what you would call contents or extracts of,
right,
for which you're probably not having picked up here. So the surface lectins are what they're looking at. The internal contents, such as the enzyme of the papaya or the enzyme of the pineapple, is not what you're allergic to, and that's always a misunderstanding. So we've done this for 30 plus years, and it was never a problem from that which is in your enzyme or Dehist or anything.
It's the meat, it's the volume of the flesh of these food products and fruits that you're having the greatest reaction to. The extracts of, and specifically the enzymes inside of them, are not going to cause you an issue.
Correct.
And we get this question a lot with Juice Plus too, because there's 30 different fruits and vegetables in Juice Plus, and sometimes some of those show up on the food sensitivity test.
Same rationale.
Same rationale. Okay. Okay, next question says, at my place here, recently my 59-year-old husband wakes up at night to pee. What can he do so he can sleep through?
Well, there are many, many ways to answer this. If he's drinking a lot of water prior to going to bed, I would end his water consumption at around 6 p.m. And then all the things I just recently mentioned, enzymes, blocking your high-carb diet, getting off alcohol, using estrogen blockers like diindolylmethane or anastrozole, EDTA chelation. All these things help with that issue. And of course, he should have a prostate exam, so should the other gentleman, and have the size of the prostate felt and get the PSA tested and look at those things. But the prostate is growing, and this will create incomplete emptying of the bladder, so that there's more, the volume isn't expelled. And so when you drink a little bit, it'll add to a tank that's already half full, and you'll have these problems. So what swells that prostate and constricts the passageway is the estrogen that a man has and is promoted through alcohol and a high-carb diet. Right.
Rewind the video a little bit, or play back at the beginning, because we answered a very similar question in detail on that. A question here from Val says, I'm a patient of Dr. Patel, and if I test positive for COVID, what are the steps to reach my doctor to get treatment immediately, including monoclonal antibodies, specific phone number, a COVID hotline?
Well, there is no rush in the sense that as long as you're being addressed and start treatment within about 7 to 10 days, this is considered early treatment. So just call the front office, 714-544-1521, and tell Dr. Patel, and she will have the phone message, contact you, and start whatever therapy is appropriate. And so again, 7 to 10 days, and if you're living a healthy lifestyle, and I'll just have to tell you, we know that this CDC, and I've been telling you that the PCR test for COVID has not been reliable since February of 2020, almost 2 years ago. And Kerry Mullis never endorsed that. He said it should never be used for testing. And so these antigen antibody tests are not reliable either. And it doesn't test with specificity. There's a whole family of coronaviruses. And that's what gives us the common cold. So do you really have this alleged corona of the Omicron or any of the variants? You have to understand, your body is well designed to stay well. If you give it the healthy environment it should exist in, and you should have plenty of time to be able to contact. So there's no emergency here. There's no emergency. We have 7 to 10 days to get you started on something.
Okay. How are we doing here on time? Maybe time for 1 or 2 more questions. Talon, that's histamine intolerance to pineapple and tomatoes. Okay. I'll have to look into that. I think she's referring to my question about pineapples.
Your mouth, yeah.
Okay.
Okay.
One more just popped up. How can you tell if you have Omicron or Delta variants? Does monoclonal IV help with Omicron? Do you do the IVs at TLC? I can say that we've been working on getting the monoclonal antibody treatments here, but our doctors have been a little bit on the fence with it because we see such great results with the vitamin C IVs.
Yeah, what we're doing.
However, we are trying to get that because one of the biggest benefits is it's completely paid for by insurance. So there's no out-of-pocket to the patient. And we have seen good results with monoclonal antibody treatments. It is available in our area. In fact, one of our partners that helps us in the lab, they have a site here in Santa Ana, just a couple minutes away. So we can get you that information. Now, what would you say about the test? And they're not going to tell you whether you have Delta or whether you have Omicron.
Right. So, and then do you trust the test? So there are 3 immunoglobulin, the original like Regeneron and the one before that, I don't know their names right off the top of my head, but there's a new one out right now that has a single antibody, which is, they say, I can't remember the article percentage, but there are 3 now, and they're saying that the most recent one, it starts with an S, Solumatab or something like monoclonal antibody infusion, is having some benefit with Omicron. So, but we're having great results with vitamin C. We're having great results with using other alternative therapies. So do you need to take that? I'm a bit concerned about the long-term effects of these emergency use authorizations for these monoclonal antibody infusions. And since we've done so well without it, I'm not a fan of trying out new things on my patients.
Okay, good answer. Why do search engine results for Juice Plus result in negative or at best neutral articles and reviews?
Well, you have to look at the owner of Google Engine, and you have to look at these people who have an agenda. They make money off of pharmaceuticals. And so if your mainstay, and you look at your news brought to you by Pfizer, brought to you by Merck or whatever, this is all interrelated. So I'm going to tell you that these search engines are designed to keep you in the norm, standard, lousy diet, disease-producing, immune-suppressing, getting you into a drug system that requires you to pay into the system and make them wealthy. And so this is all false. I have over 30, well, I would say 23 years now using Juice Plus, and I can't see any one single item, I would say, compared alone to Juice Plus as the long-term anti-aging health and endorsing. And the owner of Juice Plus is, what is his name?
It's slipping my tongue right now as well, too.
Yeah, he's, I think, 86 years old, 87 years old.
DuBois?
No, that.
Jay Martin?
Jay Martin.
Jay
There
Martin,
you go,
yeah. He is a living testimony, and the people that are who originally introduced it to me, they were diabetics, and they were overweight. And I thought, you know...
And you looked at what little research papers there were on it at the time, and you said, this can't be right.
Right.
So you ran your own study here at the office.
And my research was proving me wrong, that it was probably the single most immune, antioxidant, cell-protecting item I could do. So, but what I'm getting at is over the years, 23 years now, I've seen these people who are now in their late 80s, and they are still alive. They have not succumbed to their diabetes or their overweight, obesity, or so forth.
Right.
So I
And
just,
as far as this question goes, just to tag on to you there, you could replace Juice Plus with just about anything that is natural or functional. And the way those search engines work, or just information in general, is the juicy kind of like, oh, did you know, bad news type of stuff tends to get more attention. Negative news gets more attention. It sells the headlines. Good news about, supplementation, reducing or increasing your antioxidant protection, or helping, with your exercise and workouts and skin. That stuff doesn't necessarily sell headlines, and the stuff that does makes it to the top.
And I would say the criticism of the research on Juice Plus, there's 42 peer-reviewed articles, and they say, oh, it's bought, and it's, I would ask those same people to use the same scrutiny against the pharmaceuticals.
Who do you think pays for these?
Yes.
Research has got to get paid for.
Exactly. And the CDC and the NIH and the HHS, look at their nepotism and their control of these things. So it's a mess. You have to have a moral heart, a guidepost, and say, this I have studied, this, and I challenged it. I did my own research. So I'm not going to go back on that. It still gives me the great results I'm looking for.
Right. Yeah, the clinical experience speaks for it all, what we've been able to do and see with our patients over the years.
Right.
Yep. All right, folks, well, that actually takes us a little over time. Thank you so much for the lively discussion and the tons of questions you all asked. Hopefully we were able to answer yours. If not, we'll do our best to answer it on the next episode. Dr. E will be here Monday at 6 p.m. And that's a longer episode as well, too, so you can, if you didn't get your question answered here, please bring your question to Monday night. Just take a quick moment before you go. If you found value out of this, hit that thumbs up button, like the video, and subscribe. That helps us spread the news, spread the good word, and we thank you for it. All right, well, guys, we'll see you on Monday night, and we'll be back here next Wednesday at 9:45 a.m. Pacific. Until then, everybody, be well.
God bless.